What's up? All right, let me see if I can get this going in the right order. I got all the things open. So what's up? My name's Dr. LeBauer, and I'm a physical therapist. I own a cash-based physical therapy practice. And what I want to do is talk to you today about the No Surprises Act, the good faith estimate, and what you need to be doing next week. And the APTA advisory that they put out. Okay, so if you're anything like me, you're actually focused on running your business and not like, these are my lights, super focused on like rules and laws and regulations. So this kind of came as a surprise to me. As I'm sure this came as a little bit of a surprise to you, and maybe you're feeling like, oh, I've never heard of this. Okay, no worries. I'm gonna try to break it down in as best as I can. Okay, if you're watching and you're not a subscriber or following me, make sure you like, subscribe, and hit the notification bell, and you do those things so that you can get access to more videos and trainings as we put them out and more information comes out. So just a little bit of background, I own a 100% cash-based practice here in Greensboro, North Carolina. I also own LeBauer Consulting, which is a coaching business where we help thousands of cash-based practices and physical therapists create online businesses and in-network hybrid practices scale their time, income, and impact. Okay, so what's the deal? All right, a few weeks ago, I've been getting these messages, Aaron, what do we need to do? And etc. I'm like, I don't know. I'm like, it's Christmas time. Like, I'm chilling. But I got a bunch of questions, and I went to look at it. Someone said, hey, Aaron, what's up with this article that's over on the APTA website, this practice advisory? And I wasn't able to get access to it because I'm no longer a member of the APTA. Cool, fair enough. I'm not a member of the APTA, I can't get access to it. So this week in one of the other groups I'm in, it's the Brandon Smith's Discord, the outcome, the, what's it called? Income and Investing, the Outside the Box Income and Investing Discord. Okay, group. Someone posted the PDF in there that they got through from the APTA. So I want to give Brandon credit because that's where I got his group, was I got this, this PDF. I skimmed the PDF, and the way it reads is that it reads to me like the APTA came up with an opinion on what we should be doing. And we should be giving our patients good faith estimates, etc. But it didn't have all the information and it wasn't very clear, and clearly I think it missed the ball. Now I'm going to throw them under the bus for a minute and say they should just make it available to everybody. Because I saw on Twitter where someone posted and who tagged me and said, I'm surprised 99% of therapists don't know about this. Well, yeah, the government never called me. I never got a letter saying, hey, as a registered healthcare provider, here's a new law. Like, yeah, I think it only made CNN this week. You know what? Ignorance isn't an excuse, and I know that. And what I'm saying is, there's no wonder we don't know about it. It's because any information, like I couldn't go get it because I had to be a member to get it. And I believe that for information like that, it should be available to everyone because I don't know, I'm more likely to become a member if I can get access to this kind of stuff. It should even just be a lead magnet. Same thing happened back in COVID. The COVID guidelines should have come out and everyone should have had access to them. Now I'm a little off the point, but that's the information I had. I made a video earlier this week. Clearly I didn't have all the information, and I am not a lawyer. I'm not a healthcare compliance expert. And I really hate reading through this kind of stuff, but I've done it and I want to try to help it make sense to you. Okay. So I got a message from a colleague who said, Aaron, I would love to talk to you about this because someone asked me about your video. And I said, well, did you watch my video? And he said, no, I didn't. I said, well, here's what I read and here's what I understand. He said, you got to understand, here's some other pieces to it. And I was like, well, that wasn't in the communication. He's like, I know. So I still don't have all the answers. I have more questions than I have answers. But let me break this down for you as best as I understand it today, December 29th, 2021. It's called the Good Faith Act, was passed. I don't know, it's meant to keep you from being taken to a hospital in an ambulance that's out of network and getting a surprise bill. It's the No Surprises Act, right? Or getting a surgery and the anesthesiologist is out of network, but your surgeon is in network and now you have this $1,500, $3,000 bill. Or probably even from clinics who, the way I thought it applied to PT is that, you know, there's a bunch of clinics and PTs that don't know what patients are actually being charged. They just provide the service. We need to do an eval and patients expect it's going to take a copay. Insurance doesn't pay much. I see that you're looking at my camera right there. Let me just move this guy. The insurance doesn't pay much, and so you get a bill at the end of the service. Okay? This is annoying me now. There we go. And you're shaking around. There we are. Annoying me. There we go. Okay, so you get a bill 6 months later for PT, and you're like, that was okay, but why am I getting a $2,000 bill or a $1,500 bill now? So it's to prevent that. And I totally agree that we should have transparency in our healthcare. Like, our business is already transparent. Our business we already tell you, this is how much we think it's going to cost. And you go, okay, great. I want to work with you, and you pay us money. And there are no surprises, because I don't bill you at the end. I might say, hey, Mrs. Jones, it looks like it's going to take a few more visits, especially now that we're going to work with you on your headache and migraines, even though you came in for your back pain. Would you like the plus pack of 5? And people go, absolutely. Like, there's no hidden costs. There is now a little extra burden for me. I've had to spend an extra 5 to 10 hours thinking about this week instead of being with my kids or working on other projects I had planned. And now my staff has to spend an extra amount of time. Like, we'll eventually streamline it, but they have to spend extra time training, getting this right, and figuring out how it works in our system so we don't turn people away. We actually get people in for PT. So let me get down to what you need. And I'm going to drop a few links. If you don't have the links, I'll come back later. I'm going to drop them in the video in the Cash PT Nation. So make sure, if you want to get the links to the resources I'm going to share, the Cash PT Nation on Facebook group, and they'll definitely be in there. These are things that I haven't even shared this stuff with my Platinum Mastermind yet, because I was like, well, I could just do the video for them, but it's too important. I was like, well, I could do the video in my PT Business Ignition group for all my private coaching clients, Platinum Mastermind members, etc. But this is still too important, and everyone should have this information, just like I think like it should have been given like for free before through the APTA. So everyone is going to get this information. I just have to figure out how to get these links into all the locations of the videos, because I got 1, 2, 3, 4 videos in 6 locations. Fair enough? So there is, if you have any questions, you specifically have any questions, you can put them in the chat, and I think I'll be able to get them and see them. Okay? So let me just open up a couple links and make sure that I can get this in the right places. Okay? So the first problem is it's not very clear. The second problem is not a lot of clarity around exactly what we're supposed to do. Here we go. Okay, so I'll put these in the Cash PT Nation, and if you need them, come in there. If you can, okay, for waiting, I can try it. I'll put them in below the video on YouTube. Okay, so let me go in here. There's the first document, I'm going to copy and paste in here, is the APTA Practice Advisory. Okay? My number one beef is, it sounds like a practice advisory, not like a, hey, there's this new rule, and here's how we think you should do it, and it's still not very clear. I'm like, it's just like, it seems like an opinion piece. Okay, great. So there's that. Then there's also, let's see, what did I have here? There was another document. I want to get this for you. Okay, it is like the CMS guidance and FAQ. Let's see. This is a bunch of blah 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 stuff. You know what? Wrong email address. Here, this is like, I think this is the surprise billing and transparency requirements, like provisions in federal code. So I'm going to put this in there for you. I'm also going to say that if you're like confused, like find a lawyer or compliance specialist that can help you out. Rick Gwenda, Nancy Beckley, Gwen Simons. I work with Gwen, and I know Gwen's going to be putting out a webinar or training sometime in the next few weeks. If you, you know, if you feel like you need that, you don't need to worry. The number one thing that Gwen told me is right now, don't worry. And this is what I said earlier, like, don't worry, because there's going to be a delay in like enforcement unless someone complains. Okay. Let's see. Okay. So there's another document that I'm going to put in here in just a second. There's a great page here with. I just went to Google and looked this guy up, and it's got all these forms and downloadable things that you can go read through. But there's one form in there that's form number 2, and I'm going to talk through exactly what you need to do here in a second. Let me just get all these things in here. Aha, here it is. Okay. It's like appendix number 2. Okay. Appendix number 2 is this good faith estimate template. So let me break it down for you as best as I understand it. And if you understand this better than me, I'm happy for you to comment and provide some clarity. It would be great if you are, like, this is your specialty and not just your opinion. I'm not trying to give my opinion, I'm giving my best understanding so that you can go into the new year like feeling clear and not worried. Okay, this good faith estimate is, like we said, it's to help provide transparency in healthcare. I'm all for that, okay? The thing is there seem to be no exceptions to who has to provide this, right? So there is, it says in one of the instructions, I'll just read this briefly for you. Let's see if I can find this page. Oh, I left it with my team. But it's basically like a provider is anyone that's like a licensed professional provide a healthcare service. Okay, clearly PTs fall in line with that. Okay, what about massage therapists? My wife's a massage therapist. She's licensed, but it's not clear. So that's a question I have. Let me say this. As a PT in a cash practice, you have nothing to worry about. And good faith estimates are required for people that are uninsured or have private insurance and have no plan to file a claim. So some people are saying that's almost all cash practice patients. I don't think it's all of them. We have very few uninsured patients coming to see us. A majority of our patients intend to file a claim, but many of them, by the time they see us, don't care, and they don't, right? So let me just try to make this clear again. So if people are uninsured, they need a good faith estimate. If they are insured but don't plan to file a claim, they need a good faith estimate. If they request a good faith estimate from you, they need one. Okay, those 3 things. If they're Medicare or government insurance, they do not, because you're supposed to be filing a claim on their behalf anyways, right? As a Medicare provider. So how we are going to do this at the moment is patients call in, they ask about PT, we get them scheduled for a total body diagnostic, which is our consultation visit. And at the end of the consultation visit, we will still offer them a plan of care like I typically teach. And then as they check out with Amber, she'll make sure and asking the questions around, are they like, what insurance do they have and are they insured, right? And so if they don't intend to file a claim and they're uninsured, we'll give them a good faith estimate. If someone requests a good faith estimate, we need to provide it. How do you provide a good faith estimate without actually evaluating someone? This is a big question I have. I could say here's a standard thing. I still don't want people to just like call us and say, hey, give me a good faith estimate. I'm like, yeah, I need to be able to see you and talk to you first and really figure out what's going on so I can tell you. What I can say is I know exactly how much one visit's going to cost. As your coach, I don't want you telling people your prices before they buy into your services and you figure out if you can help them and figure out how and what their big why is. So my plan right now is not to lead with this, but to follow up with it. Because according to the rules as I interpreted them, based on when you schedule someone for the healthcare covered service, you have up to 3 days to provide them. If you schedule them within 3 days, you have to provide them a good faith estimate within, I think, 24 hours. If you schedule them, up to 10 days, you can provide it within 3 days. A little weird and arbitrary, but you can get this to them within a day or two, no big deal. Because I already know what it's going to cost, because if you need 8 visits, it's $19.98. Like, there's no surprises there. So it's just some extra paperwork. So the last link that I put in below is a template that you can start using. And I would say this: if someone requests a good faith estimate, or you know someone's uninsured and you want to do it, you can try to use this form. Like I said, there are more questions that I have answers for. And just know in January there's going to be there's probably not going to be a lot of enforcement unless you're doing some shady stuff, and you should be enforced upon anyways. So how we're going to do it is you call, you schedule a total body diagnostic, which is our consultation visit. At the end of the consultation, if we think you need a plan of care, we will still say, hey, Mrs. Jones, the plan of care is going to be this, $19.98. Here's what you're going to do. And then they'll go out, and as we process the payment, we will let Mrs. Jones know, or ask the question around, do you intend to file a claim? Sorry, that's my alarm going off. My daily alarm to go home. Do you intend to file a claim, or, are you insured? How will it be enforced? When people complain, if people file a complaint at the moment, and the complaints can be filed if they get a bill that's more than $400 different than your good faith estimate, they could file a complaint, or they can file for arbitration. Like, there's no way that someone's coming to my clinic and they get a 10 visit pack and they pay $250 a visit, it's $2,500, and we're charging them $3,000. Like, that doesn't happen. It doesn't happen. Like, it's not going to happen, right? And there is information in here that says, like, this is a reasonable estimate. It may increase due to unforeseen circumstances, and we're always upfront with people anyways. So I think that the key take homes are this: people who are uninsured, people who do not intend to file a claim with private health care insurance need one. People who request need one. Medicare, government insurance patients like VA, TRICARE, Medicaid, they don't need one. Okay? Don't lead with this, because you'll turn people away. People may not even know or care, especially if you do your job right, as I've taught you. And then you say, hey, by the way, Mrs. Jones, just so we can make sure that you get everything you need, what's your insurance? And they tell you, and then if it's Medicare, okay, great. If it's Blue Cross, great. If it's Blue Cross, they say, are you intending to file a claim with your insurance? Like, that's as a cash practice. If I'm an out-of-network practice, I might still file a claim with them. And if I'm filing the claim for them, like, they don't need it. But if they tell me, if they're coming to me as an out-of-network, like a hybrid practice or even an in-network practice, and they say, you know what, I don't want to file a claim, I want to pay in cash. Well, great, they need a good faith estimate. Okay, like I said, I've got 20 more questions, and I'm not going to go through those. But the link that I provided is something, it should be something, it's a PDF. You can download it and use it. You can, what I did is I downloaded it and I opened it as a Word file to edit it. And I edited it and I put in my clinic name and did some things with that. I'm not going to give you the one that I edited because I didn't change much other than put my pre-filled in my clinic name. But I think you can start using that. And, like, Robert, you're right. This shouldn't apply to cash-based PTs, other than there's no exceptions to the providers that it applies to. And this was what Rick told me, Rick Gwenda said, they put this in at the last minute in this bill, is that there's no exceptions, and I believe that the APTA is working on something about this with them. I don't know exactly what, with CMS and trying to figure that out and make it easier. But it doesn't, because there are no surprise charges, and the way this bill was written, this federal law was written, is that it applies to all of us, which is total bullshit. But there's not enough of us right now for them to notice and know that it's a burden on our business, and we're already transparent with our pricing. Does that make sense? It's not the big burden. It's a small burden, but it's a pain in the ass. And sometimes you gotta do what you don't want to do because it's the right thing. And overall scheme of things, I think there's no problem with the No Surprises Act. I think it's great. But there should be a couple exceptions. Like, maybe we weren't as PTs, we weren't at the table when this bill was written. Or maybe we were at the table when this last thing got shoved in. It said there's no exceptions. That no exceptions makes it confusing, because there's multiple providers that could be involved in the plan of care. Well, is a massage therapist a provider if their service is or isn't billable, or they're licensed, or a personal trainer who's providing personal training? Like, they're not licensed, okay, but if they are a PT and you're acting as a personal trainer, Practice Act would say that it's not a billable service, because if you're holding yourself out to be a trainer or fitness person. So where is that line drawn? Like, I don't have that information. So let me just say one more time. I'd love to, if you have any questions for me, I'd be happy to try to field them. With this, I would say that hopefully there's more information out now. What was surprising to me was that the No Surprises Act was a surprise, but I got something in my eye. I'm not surprised that the No Surprises Act was a surprise. Would love these things to not be surprises, but I also have my head down in the stand trying to plan PT BizCon and mastermind events, coach my clients, hang out with my kids, and go skiing over the holidays. So, but we should be, why didn't we know this in like November, early December, October? I don't know, whatever. It would be nice. So don't be surprised that no one knows about it, and here you're learning about it. It's really going to be fairly simple. I can foresee a pre-fillable form, or even using Intake Queue, and which is the EMR system that we use, and have all the codes. It's basic information that's still on our super bill is on this. It's really the same information on our super bill is going to be on this. But what this is asking is for me to say, hey, you're going to need 3 units of manual therapy and 6 units of Therax and 1 unit of something else, and within the next 12 weeks, and here's what it's going to cost. And I think it's great, but there should be exceptions to the rule, and they're not. So what's that? What would I say next is, over in the Cash PT Nation, if you join late, I put a bunch of links in the Cash PT Nation for you to reference and read. When there is like a webinar or training, or I know Gwen's going to do something in the next few weeks, probably later in January, I will let you know that. I'll post it in the group, and I'll send it out to my email list. If you're on my email list, you'll get first notice. For the next 30 days in January, don't worry, don't stress. I think what Gwen told me was like, provide these to people if they request it. And I think what we're going to do is, I've done the training with my team, so we're going to start screening people. But I would love to find ways to screen people that are a little easier, a little bit more streamlined, like in the questionnaire or sometime. But what I don't want to do is start talking about my rates at the beginning of the conversation. I want to talk about our rates, cost, charges, insurance at the end, once we've gotten the transformational information, done the motivational interviewing, and we've got patients to agree to a plan of care that works for them. And by then they've already agreed to the price, and then it's like, hey, by the way, there's new federal regulation, and we're going to be sending you a good faith estimate. It says all the same things we went over today, but if it doesn't look like what we talked about, let us know, and we'd be happy to revise your plan. And then voila, and then we're good. Okay, if you want more information like this, be sure you hit the subscribe, click the notification bell. You can opt into my email list if you're not already, by going and getting the 35 Marketing Strategies guide that I have. It's 35marketingstrategies.com. And if you're interested in getting more information, more help, and you'd like to work together in 2022 to make 2022 your best year ever, just shoot me a DM with the word 2022, and I'll send you more details about how we might work together and figure out what's the best program for you. Sound good? Would love to, before we sign off, would love to know what's been most helpful for you about this. Leave it as a comment below. Even if you're watching the replay, comment below. Let me know what your insight is, what's been most helpful for you about this. Even what question you have. Even if I can't answer the question, I can pass this question along to one of the compliance specialists that I know and work with, and we'll try to get that back out to you as soon as possible. Now it's time to go home. Talk soon. See you on the next video. Thanks. Peace.